Last week in the Friday Value video, I started a little mini series on got back pain, and this is part two. And what I want to share with you, I'm going to go in a little bit deeper. I shared with you last week about the McKenzie program and recommended this book for a person, again, who I have not assessed, who talked about having disc bulges. And if that person is experiencing radicular pain down their leg, this is not me diagnosing anyone or treating anyone. I'm simply providing information. There is a classification used in the McKenzie Method program. And if you're classified with a derangement, especially if it's a posterior derangement, when you're seated, the pain gets worse down the leg. Bending forward, the pain gets worse down the leg, that kind of thing. That is very successfully resolved using the McKenzie method. And so I highly recommend this for anyone who's got radicular pain going down their arm, going down their leg, could be from the neck, from the back. This method is extremely successful. I had a young man who could barely walk. He was in so much pain, very, very strong young man. He was in his 30s and he had a physical job and he was adamantly against surgery. He was told he needed surgery. We used the McKenzie method, and in 3 weeks, he was completely free of pain. And in 4 weeks, he was back to work with no restrictions in lifting. So this is successful. I've seen people get out of pain in 15 minutes using this method. So please look into this, but it has to be the appropriate treatment for you because there are different reasons. So now I'd like to take a moment and talk a little bit about disc health. Now, your discs, these nice cushiony things between the vertebrae, they separate and protect your vertebrae from rubbing together. They provide that cushioning. They have an outer ring called an annulus. It's kind of like a radial tire with crisscrossing fibrous bands, and a gel-filled center called the nucleus. Now, if you want more information about this, I write about this in chapter 5 in my book, Pain Culprits, which you can take out of the library. But if you don't want to get the book, I'm going to finish just this little section that I wrote in the book. So you can think of the nucleus kind of like a ball bearing. And when you move, it allows your vertebrae to roll over that incompressible gel. It can't be compressed. That gel is mostly fluid and it's absorbed somewhat, little bit during the night when you lie down, and it gets pushed out during the day as you move around in upright positions. That fluid movement may be why you experience more pain upon waking, if you do. And then once you get moving, you feel better until the next morning. Now, that's only if there's some issues going on with your spine. Now, disc herniations themselves, they can be described as bulging. They can also be described as protruded, extruded, sequestered. Lots of anatomical terms. Now, bulging and protruded terms are interchangeable, so it depends on the person you're talking to. And that means the disc is still intact, but it's migrating toward or against structures like nerve roots. Extruded means the gel's leaking, but it's still attached to the disc. Now, sequestered, that is a true herniation. That means the gel and possibly pieces of the annulus are completely separated from the disc, and they can put pressure on the nerves and create severe pain. And as I said, only sequestered are true herniations, medically speaking. And often they require surgery. There is no getting around that. But I can count on one hand the number of times I've recommended someone to go see a neurosurgeon. And there is a neurosurgeon that I quoted in my book that he teaches and he runs a clinic and he's a neurosurgeon, and he says only 5% of people with back pain actually need surgery. So it's a lot more rare than we think, the need for the surgery. But if you're tripping on your toes or any other sign of unexplained muscle weakness, get to a neurosurgeon. I highly recommend that. But it's not a common occurrence. So there are manual techniques that I had mentioned last week that I want to go into in part 3 of this series. The reason you're seeing McKenzie program here in manual techniques is because oftentimes if you see an expert who is certified in McKenzie, and I highly recommend you find someone certified in McKenzie because it will make a huge difference in their ability and their skill to be able to help you should you be classified as a derangement Most often it's posterior, sometimes it's anterior, but they may need to put their hands on you if you have something called a lateral shift, or there are some other things that can be looked at and you might need help with. But for the most part, it's hands off. But there are other manual techniques that can be extremely helpful if McKenzie's not appropriate for you. And I'm going to talk about those next week. In the meantime, please remember to be informed, to move without pain. Life really is meant to be enjoyed, not endured. And you don't just want relief of your symptoms, you want resolution of the cause. I know that's your goal. I will see you next week.